Okay, we're going to be finishing up with endocrinology with some endocrine disorders. So if you look here on the left-hand side, you'll see that this is an individual here on the left-hand side that has a condition called giantism. Um, if you look in the middle here, this too involves growth hormone, but when you have excessive growth hormone during adulthood, it creates acromegaly. When you have excessive growth hormone when you're younger, you can get a giantism. Okay, there's a big difference. So acromegaly is when there's excessive growth hormone in an adult and you get this really large forehead, you get really pronounced chin, uh, like caveman-like, eyebrows, and the brim becomes very, very thickened. If you look here on the top right, this is a goiter, and a goiter is just an enlarged thyroid gland. It doesn't really talk about the cause, it's just an enlarged thyroid gland. Here in the middle on the bottom, this is called exophthalmos. This is seen with a hyperactive thyroid in a condition called Graves' disease. Notice you see the white of the eye on the top, on the side, on the bottom. Typically, you shouldn't see the white of the eye on the top. On the bottom, you could see it, and on the sides, you could see it. But to see the white of the eye and to see the eyes bulging out like that, that's called exophthalmos, classical indicator of a hyperactive thyroid or Graves' disease, which we can see here. See the white of the eye? That's exophthalmos, hyperactive thyroid, Graves' disease. Here's a condition called Cushing syndrome, which is from prolonged exposure to either endogenous or exogenous. This means like self-produced or exogenous, getting it from outside sources of glucocorticoids. So if people are taking cortisone, corticosterone, if you're taking it exogenously or your body is producing an excessive amount endogenously, it creates this condition that we saw here called Cushing's. We have these red cheeks, you have this round face, like you see here. They call it a moon face. You have red cheeks. You get this Dowager's buffalo hump here. You get red striations, like these stretch marks along the umbilicus, around the belly, around the chest. You bruise easily. You get poor wound healing. The belly is pendulous, so there's a large, puffy uh, belly, but the legs and the arms tend to be a little bit thinner in relationship. And you get high blood pressure. You get thin skin. That's Cushing's syndrome. See the round face here? You see the purple striae, those stretch marks. You see the stretch marks along the belly. This is much thicker than the lower portion. And again, you get that buffalo hump here at the base of the neck. Okay.